Today we will be examining the evidence surrounding vitamin D and folic acid as nutritional interventions in the prevention and treatment of colorectal cancer. Currently, colon cancer is the third most common cancer in the world. According to the American Cancer Society, there will be nearly 50,000 deaths in the U.S. from colon cancer this year. Cancer is a disease in which abnormal cells proliferate uncontrollably with the potential to invade and spread to other tissues. Colorectal cancer refers to a malignant neoplasm in the colon or rectum, which is the distal part of the colon.
Colon cancer is most prevalent among the older population, and it is prominent in both men and women. Major risk factors include obesity, poor diet, lack of exercise, smoking, and heavy alcohol use. Common symptoms of colon cancer include constipation, diarrhea, bloody stools, consistent gas or abdominal pain, and unintentional weight loss.
Because of the overwhelming number of people affected by this disease, finding effective treatments is a huge area of research. The most common treatments for colorectal cancer are surgery, radiation, and chemotherapy. Researchers are also exploring the usefulness of micronutrient interventions. Our research question specifically is whether or not vitamin D and folic acid are useful in treating or preventing colon cancer. We hypothesize that they are.
The first article we will present supports the usage of vitamin D to treat and prevent colorectal cancers. The study was a randomized, double-blind placebo control. The researchers tested calcium and vitamin D taken daily, combined and alone, for 6 months in reducing neoplasm and pre-neoplasmic biomarkers. The tissue biopsies were taken from normal-appearing rectal mucosa, measured by enzyme-linked immunoassays. The results were that the combined vitamin D and calcium had the highest number of neoplasms formed, while the vitamin D alone and calcium alone had a similar number but lower neoplasms formed. Another article was a meta-analysis of the serum 25-hydroxy-vitamin D levels and mortality rate of patients with colorectal cancer. 25-OHD is a prehormone which is converted to vitamin D in the liver. The study looked for papers with specific mesh terms from the years of 1996 to 2014. 4 papers were found and statistically analyzed. The higher serum 25-OHD was associated with a 47% reduction in mortality. The results suggested that individuals that have lower levels of vitamin D should have their vitamin D levels restored to a normal range. The author notes that the studies do not comprehensively assess the confounding anti-carcinogenic effects and carcinogenic effects from behavioral factors unrelated to vitamin D, so more studies need to be performed.
The next article we will look at describes a cohort study of women which shows that baseline plasma 25-OHD was significantly lower in colorectal cancer cases than in controls. In this study, participants with levels greater than 29 nanograms per milliliter experienced the greatest reduction in incidence of colorectal cancer and mortality. Another study published in 1989 suggests the same correlation. This study also measured serum 25-OHD in subjects. Case and controls were similar with respect to age, sex, and time at which the blood sample was taken. This study found that the risk of colon cancer was reduced by 80% in individuals with 25-OHD concentrations between 27 and 41 nanograms per milliliter. This article concludes that the researchers' findings, together with previous studies, suggest that vitamin D metabolites reduce colon cancer risk. Based on the evidence from these studies, the overall grade for vitamin D is a B. Although there is one double-blind placebo, the other 3 articles are meta-analysis or cohort studies, which are not as strong. More evidence is needed to definitively conclude. However, the overall recommendation is to maintain normal levels of vitamin D, as there is a correlation between vitamin D and colorectal cancer.
In addition to vitamin D, studies also suggest folic acid may be useful in preventing and treating colorectal cancer. Low folate diets have been associated with an increased risk of CRC. However, clinical trials give us conflicting results. Today, we're going to look at 4 relevant studies.
The first study supports folate usage to prevent the recurrence of colorectal cancer. When researchers compared a group of participants that received folic acid to a control group that received a placebo, the folic acid group had a significant reduction in the recurrence of colorectal adenomas. This trial was a well-conducted, randomized, placebo-controlled trial that lasted a long duration of 3 years. In addition, it was included in a larger meta-analysis which used quality controls in the form of selection criteria. The next 3 trials do not support folate usage in treating CRC. One trial aimed to test the effectiveness of taking regular aspirin and dietary folate to reduce the risk of unusual tissue growth in colon. This trial contained 4 groups of participants, with each group differing in their consumption of folate and aspirin. The results showed no significant difference between the groups. This was a randomized, double-blind, placebo-controlled trial with a large number of participants and an even distribution between males and females. This was also included in a larger meta-analysis, and this was a multi-center trial.
Another study investigated the association between folic acid supplementation and colorectal adenoma recurrence in a randomized, double-blind controlled trial using participants with a history of colorectal adenoma from 2 established cohorts. Overall, no significant association was found between folic acid supplementation and number of recurrent adenomas. The major strengths of this study include a large established cohort for randomization, assessment of participant compliance with blood samples, the long study duration, and the double-blind nature of the study. Further support for the lack of a definitive chemopreventive effect of supplemental folic acid was reported in a strong meta-analysis of 6 randomized controlled trials. No effect on the relative risk of colorectal cancer from folic acid supplementation was seen in either those with a history of adenoma or the general population. The strength of this meta-analysis is evident by the validated study design used to filter and identify RCTs, the selective inclusion criteria, detailed quality assessment of the included trials, and the variety of doses used in the included trials.
The level of evidence supporting our hypothesis that folic acid is useful in treating and preventing CRC receives an overall grade of C. Although the studies were very well conducted randomized control trials, the results of the trials were conflicting. One trial supported the usage of folic acid, while the other 3 did not support the use.
In conclusion, the evidence we examined that supports our hypothesis for vitamin D received an overall grade of B, and that evidence regarding folic acid received an overall grade of C. If these trials convinced you of the effectiveness of the nutrient in the treatment of colorectal cancer, you can load up on vitamin D by eating salmon, tuna, and getting your fair share of sunshine. Eating lentils, dark green veggies, and citrus fruits are some of the richest sources of folate. As you can see, more grade A evidence is needed in order to confidently recommend either one of these nutrients as a definitive treatment of colorectal cancer.